Are you someone who's suffering from chronic symptoms that just seem to get no relief from diet changes, from medications, from supplements, from different alternative healthcare practitioners? If you are, you deserve to hear this brief testimonial from this lovely woman, Paula, a 33-year-old woman who came to my clinic with terrible symptoms, referred by her dentist because he knows what I do for people with these chronic symptoms. You're going to hear from her in just a moment and hear about her incredible relief from these terrible symptoms. And when I come back, I'm going to tell you what I found in her examination. I'm going to make you a free offer, tell you how to become a patient here in my clinic, and then hopefully see you soon. So let's take a break and hear what she's got to say, and I'll come back in just a moment.
I have like more than 1.5 years with the pain, and after your medicine, the treatment have decreased a lot.
Awesome. Reduce. So we have a reduction of more than 80% of that pain.
Yeah, more than 80%. Yeah.
More than 80%. Now the rash, since it was every day, now do you even have the rash?
It's only in here, in this part, and in the knees. But it's not every day. It's when I eat some carbohydrate only.
Okay. By the next protocol with me, you and me together, the next treatment that we do, the next exam, this should disappear completely.
I hope.
Yeah, you hope and I know.
No, it's not like before. Before was all the body, not only here. It was all the body that it had the rash. Yeah.
Mm-hmm. And that rash that was over your whole body, that was every day.
Yeah. In the beginning, yes. If I was, in the bed or I have one position many minutes, I feel a pain that was like an inflammation here in all this, from the neck to here. So that disappeared also. I think that this was the first symptom that disappeared.
Your husband must have been happy to hear you without head pain.
Yeah, he noted because he told me, you never practice to say that you have the pain. So he told me, so I forgot it, and I say, oh yeah, you have reason. I never practice say that I have the pain. So
pretty incredible. You had a burning and a cold feeling throughout your whole body. How often did you feel the burning and the cold feeling?
I think that was the worst. I think that was the worst that I get, because I was like progressive. The pain here, the pain in the body was something like instant that I feel the heat and then the cold. So was a very scared position because nobody understand what's going on with me, and the doctor said that was impossible. Nobody believed me.
The implants you didn't have to take out, they're still there, and now you're feeling better. All these symptoms disappeared. So thank you for giving us the chance to help you. We're grateful with that. Okay. Thank you. Stay tuned. I'm going to get into another video right now where I'm going to share the different exam findings and give you a very good, easy to understand discussion about how I found what I found with her, and it will make probably a lot more sense to you.
I didn't believe it, but now I believe it because I see that I'm better and I feel better. I feel better. Awesome. Thank you, Mr. Thank you.
Okay.
Isn't it incredible how much relief she has? She came to me. She had pain in her body. She felt like her feet were burning, especially after eating. She had arthritis type pain. She had inflammation in her foot, in her toes. She had pain in half of the body, including her arms, her neck, her sciatic nerve type of pain. And she had the itching all over her body, a rash that was going on for at least 16 months before we met, when she only followed one unique protocol that I designed for her from her first examination, which I'll get to in just a moment. The heel pain was 80% better, significant improvement. The rash completely gone. Her body pain, even which she had body pain that would happen with coffee or milk, not happening. Head pain or encephalitis pain gone. Burning body symptoms, the burning gone. And the cold body feeling, even in warm weather here in Southeast Florida, she felt cold. The cold feeling gone, completely gone. How do we do it? My viewpoint, I'm Dr. Lonnie Herman, and my viewpoint is that people, from studying immunology, people have different hidden infections in their bodies, whether they're bacteria, parasitic, fungal, mold, and or viral. And you can have multiple of each of these categories of different organisms that have invaded parts of your body. And now these parts of the body are malfunctioning. And now you have certain symptoms develop in the body. Just like if you had a strep throat, a strep bacteria that got into your throat, it makes your throat swell. It hurts to talk. It hurts to swallow. It's very difficult to exist when your throat is so swollen and sore and in pain. So, and when a physician can look in the back of your mouth with that strep throat, they'll see that it's red. It might be mucousy. When you get rid of the infection, you can function normally again. You can swallow and speak normally again. So understand that when infections get into the brain and the body, they lead these parts of the brain and the body to malfunction. And then we have certain symptoms develop, whether it's a rash, whether it's itching, whether it's pain or inflammation. That's why these symptoms happen to you from infections. The other reason is deeply embedded, hidden toxins that get into certain tissues of the body. Toxins, heavy metals, pesticides, weed killer, anesthesia chemicals, epidurals, anesthesia chemicals from dental work, anesthesia chemicals and sedatives from surgical procedures you've had done before. Different drugs people have tried get deeply embedded into parts of the brain and the body. Even cigarette smoke gets deeply embedded into parts of the brain, the lungs, the body, and causes the body to have malfunction. And there's hundreds of other toxins. I won't get into all of that right now in that list, but you can go to a page on my website. That's an environmental stressor analysis page on my website. So we're going to put that link up for you here, and you'll see that there are so many different poisonous chemicals that enter the body, even antibiotic residues of different antibiotics that you've taken over the years, or maybe you consumed in the foods you've eaten, or maybe vaccines that you've had administered to you. These different chemicals can go to your brain, your liver, your lymph, your bone, make you suffer with terrible symptoms. I found with Paula, that she had the measles virus affecting her spleen, the chickenpox virus affecting her spleen, dental anesthesia chemicals affecting her lymphatic system. Before I tell you the rest, the reason why the dentist sent her here to me, because he knows I get people better with these chronic symptoms, but she had already had a root canal. She found information about a root canal could be causing part of the problem. She went to the dentist. He extracted the root canal for her. She wasn't better. She wasn't relieved from the symptoms. She brought the root canal here to me. I was able to obtain it, and I found various germs in that root canal. And I found that root canal, the germs from the root canal, and the dead energy of that root canal was still, even though the tooth was pulled from her mouth, it was in her spleen. I found it was in the stomach. I found that it was in the brain. I found that it was in the liver. It was in different parts of her body, the kidney, the lungs. So we provided safe and effective, highly energized, quantum energized formulas to help rid those negative energies, infections, and dead energy from the root canal, from those body parts. I also found that she had the influenza virus and the Epstein-Barr virus and the measles virus and the chickenpox virus affecting her whole lymphatic system. She had these viruses affecting her skin. She had the mold infections affecting her skin. She had the measles and dental anesthesia chemicals affecting her brain. She had oxalates affecting her stomach, parasitic infections affecting her stomach. She had viral infection in the meninges, tissues around the brain and spinal cord called the meninges. She had a scabies infection that was in the nervous system. Scabies is an itch mite. She had candida, 11 different types of candida affecting her brain, parasites affecting the brain, viral infections affecting her lungs and her bones. She had multiple anesthesia chemicals, including dental anesthetics, including the epidural and the anesthesia chemical called propofol that they used to put people to sleep. The epidural from giving birth to the child, the anesthesia, putting her to sleep chemical, dental anesthetic in her kidneys. When she took these safe and highly effective and customized quantum energized formulas to help her rid these specific infections from the parts of the body, from the parts of the brain, from the chemicals from the parts of the brain and parts of the body also. Once these organisms and chemicals were excreted, expelled from the body, they're extracted from the tissue and then expelled from the body. Once this was done, she didn't have the reaction to the foods anymore that she used to have, and the symptoms lifted like they never existed. And now she's better. You're going to get a chance in just a moment to hear her whole entire testimonial after this video. after I'm done speaking. And it's here to help you realize you can get better from these different chronic symptoms. You don't have to suffer anymore, even if you spent a lot of money elsewhere on trying to get better. You've tried different medicines, you've tried different lab reports or lab tests to give you lab reports. You've done so many different things. You've done diets, autoimmune diet protocols, and you've done a paleo diet, and you became a vegetarian maybe. Whatever you've done, and you're still dealing with the symptom. Or if you feel relief with a certain diet, let's say, and you stay away from that food, but you crave that food, and whenever you have that food once in a while, the symptoms come back fierce, and you have to stay away from that food. You don't have to live like that anymore. When we can find those different hidden infections and chemicals that exist in your body and help your body get rid of them, the symptoms will disappear. That is reality. I'm here to help you get your life back. You can become a patient in my clinic. In a little while, I'll tell you how to do that. The first thing is download the free ebook from my website, look through it, understand more about this work. It's very unique. It's something that can help you literally change your life for the better. Okay? To become a patient in my clinic, you'll call 954-370-3100. That's 954-370-3100. You can also email my clinic at clinic@drlonnieherman.com. Somebody will get back to you very quickly from my clinic here to help you understand how to become a patient. There's a FAQ or frequently asked questions page on my website. That page is something you should look at first. There's multiple different questions. We put together the most frequently asked questions. One about what is your investment in yourself when you're coming here? If you're coming from another state, what airport to fly into? If you're coming from another country, how do you organize that with us? Different hotels that are near us. There's a lot of information there. Okay, so click on that link about the FAQ page and understand all that information. You can even, from my website, without even calling my clinic, you can go to the book appointment page, click on that, and there's a lot of information. Easy to read, but it takes you through step 1, step 2, step 3. Understand very simply, and we made it very transparent, how to register yourself without even speaking with my clinic assistant who can help you schedule. So either way you choose. I look forward to helping you. Stay tuned and hear what Paula had to say about her life before coming here and about her recovery now. And just realize the time is now. There is no tomorrow. It's time to take advantage of the great services that we offer and a different viewpoint and get you your life back. And it can happen, and in some cases so rapidly that it's mind-blowing. I look forward to helping you. I'll see you soon.
Hi, I'm Dr. Lonnie Herman, and I'm with a great patient of ours. This is Mrs. Castano. She comes to my clinic here in Fort Lauderdale. They live down, I think you're in South Florida as well, right?
Yes, in
Yes,
Miami.
okay. Actually, your dentist had referred you to my clinic, and you sought care with him because you thought that a root canal in your mouth, you found online that the root canal is possibly infected and could lead to certain symptoms you were dealing with, right? And
Yeah.
so, but you went to the dentist, he pulled the root canal and there was no difference in your symptoms. Is that correct?
Yes.
Okay. And so let me go through a list of the symptoms first, and then I will ask you of the severity, the change in those, because we have a lot of improvement to share. That's right, from the treatment that we've done together. Yeah. Okay, so symptom number 1, you had terrible heel pain, right? Just getting up in the morning, getting out of bed, just to walk was terrible for you. That was every day. Another symptom, you had a terrible rash, a lot of itching that was on the body and a rash. You had another symptom that was body pain all over the body. There was pain. You had head pain, just trying to watch television in bed, or at another time, your head would hurt, like all around the whole head. You even had burning and cold feeling in your whole body as well, right?
Yes.
And we right now, you are, before we tell about the improvements that you're so happy to share with everybody, and I'm grateful that you're getting on this call with me to share with people. So thank you very much for that. You are maybe a little more than halfway through your protocol, your first treatment program that we set up for you, right? A little more than halfway. You actually have about another month to go in that first protocol. Your heel pain that used to be severe every day, now how much less severe is that heel pain? If we can give a percentage of how much better it is. I'm sorry, I couldn't hear.
more than 18%.
More than 80% less severe.
That is almost, out, is almost out of pain in the heel. I have like more than 1.5 year with the pain, and after your
The treatment?
medicine, the treatment have decreased a lot.
Awesome. Reduce. So we have a reduction of more than 80% of that pain.
Yeah, more than 80%. Yeah.
More than 80%. And it was every day. And now, how often? Maybe there are days you don't even feel it. Sometimes you don't feel it.
No, it's not every day. It's not when I eat carbohydrate. I feel a little of pain, but before was when I wake up in the morning. I cannot wake up from the bed, and work like normal person. No, I have to, take the slow and go to the bathroom, taking the walls to can walk. Now, no.
Holding on the walls to walk. Yeah, that's terrible. And you're very young. You're very young. You had no injury. There was no injury. There was nothing that made this happen. It's just all of a sudden for a year and a half, terrible heel pain, every day severe. So I'm happy for you already. You also had a rash that was every day. How long did you have that rash, the itching feeling in the rash for? How long was that?
I have like 1 year and 7 months, because everything, most of the everything start when I get birth my baby. So for that I say that after the surgical, the
C-section?
start everything.
Okay. So all of these symptoms then are about a year and a half that we're going to go through the list.
Yeah.
Right. So right after your baby was born, then the heel pain, then the rash started, then the other symptoms that I mentioned at first in this video. Now the rash, since it was every day, now do you even have the rash?
It's only in here, in this part, and in the knees, but it's not every day. It's when I eat some carbohydrate only.
Okay. So by the next protocol, that should be, let me just say this, I'm sorry to interrupt. By the next protocol with me, you and me together, the next treatment that we do, the next exam, this should disappear completely.
I hope.
Yeah, you hope and I know.
No, it's not like before. Before was all the body, not only here. It was all the body that it had the rash. Yeah.
And that rash that was over your whole body, that was every day.
Yeah. In the beginning, yes.
You even had to, you did a juicing diet for like 20 days of carrot juice only, you told me.
Oh, yeah, because I was making a protocol for another doctor, but I think that, was not for me. Yeah. Because maybe the sugar in the carrot, I don't know, make me feel more pain than before. So when I ate, when I drank the carrot juice, oh my God, the pain was worse. So I stopped it, and for that I went to you.
Okay. And we're happy now. You had a body pain that was all the time. So again, we had the heel pain, that was one symptom. You had the rash, the itchy rash over the whole body, that was another symptom. Great reduction in both of those. You had a body pain as well that was going on. And that, I think you told me already that that's nearly gone or totally gone, that body pain?
Yes. Because was pain like here in the middle that connect the sciatic with this arm, the left arm and the left leg. So happened also when I drank coffee with milk, and now I don't feel it like that way, because when I had that pain, I don't sleep all night with the pain, because it was something like in the nerves. I feel like I was like immobility here, like something strange that I feel that don't let me go to sleep. I don't relax my nerves in all this part of the body. But now, no, I don't feel that.
And now you sleep okay? That pain is gone?
Yes.
Awesome. Congratulations. Another symptom, the fourth of these symptoms, the fourth of 5 symptoms that you came to me for, that fourth one was you had terrible head pain around your whole head, which is different than the body pain, different than the heel pain, different than the rash. That head pain was going on when you watched television, I think you told me. Was that the only time with the head pain?
If I was, in the bed or I have one position many minutes, I feel a pain that was like an inflammation here in all this, from the neck to here. So that disappeared also.
That's
That
gone
was, I think that this was the first symptom that disappeared. This was
Wow.
the first symptom that disappeared.
Your husband must have been happy to hear you without head pain.
Yeah,
Yeah.
he noted because he told me, you never practice to say that you have the pain. So he
Wow.
told me, so I forgot it, and I say, oh yeah, you have reason. I never practice that I have the pain. So
Pretty incredible.
that was like 2 weeks after I made I
2 weeks
started.
after you started the protocol? 2 weeks after? Pretty awesome. Yeah. Were there other doctors that you had seen for this head pain in the past prior to coming to me?
Yeah, but everybody say that was maybe no, that's the gluten. No, that's, but nobody, tell me what exactly what's going on. So they also sent me many medicine. Also, I was taking Lyrica. That I think
Right.
that has
Lyrica. Sure.
a little
Lyrica,
bit
yeah.
and that make me anything.
No difference. No reduction in the pain. Yeah. Some people, they could feel the relief, but it doesn't really, it never, even if you did felt relief, which you didn't, but even if you did have any benefit reduction in the symptom from that medicine, it never gets rid of the cause of the symptom.
No, I never felt reduction with the Lyrica. Never.
And the reason why you're feeling relief, which I'm going to make another video about the exam findings with your permission. I'm going to tell people what I found with you in my exam. The reason why she's feeling relief, so incredible relief so quickly, is because we're finding and getting rid of the causes of the head pain, of the rash, of the body pain, of the heel pain, getting rid of the causes, and the symptoms just disappear like they never existed. Your fifth symptom, and this is the last one for this discussion, is that you had a burning and a cold feeling throughout your whole body. How often did you feel the burning and the cold feeling?
I think that was the worst. I think that was the worst that I get, because I was like progressive. The pain here, the pain in the body, and then I start to feel something heat in the body. But then it was something like instant that I feel the heat and then the cold. So was a very scared position because nobody understand what's going on with me, and the doctor said that was impossible. Nobody believed me about that. So when happened that, I tried it like 4 times to take out the root canal, and nobody wanna take it out. So when I found the Dr. Gorbatov, that was who told me that go with you, that was that I start to decrease that feeling, but nobody believed me, and nobody believed that I feel that was with the root canal that I had. That was making that in my body.
And the beautiful thing, since this burning and cold feeling is totally gone now, the beautiful thing is that one of the findings I discovered with her is that even though that root canal was pulled, and we're glad that the dentist did that for you, even though the tooth was pulled from her body, out of her mouth, I should say, it was still those infections from that root canal were still in parts of her body. So she still, even though she had the root canal extracted by a good quality dentist, she still had the pain. She still had the cold. She still had the heel pain. There was no reduction in that at all until I found with my method, with examining her, where those infections from that tooth went, and we were able to get those out of the parts of the body that we found it in, able to get those out with these very highly effective and safe, very easy to take remedies, right? Very easy to do. Following this protocol is pretty simple. Yeah. So we're really happy that you're feeling this way so quickly. It's awesome. I'm satisfied that my work is, helping you. Is there anything that you right now can tell anybody who's listening to you? Just, is there any advice you want to give? Anything that you can tell them besides what you've been so generous at sharing with them?
Well, if somebody has feel sick and not find the with a regular doctor the healing, I think that this, for me, that I don't believe it. I canceled the appointment. But you told me, no, believe me that I'm going to heal. I'm going to fix every problem. And thanks God I listened to you, and I went to your your place, because really that I didn't believe it, but I now believe it because I see that I'm better and I feel better. I feel
Yeah.
better.
Awesome. I remember that first call with you. You canceled. And I called you back. How did you cancel? No, your forms, you don't have questions for me.
No,
Nothing
because
matches. Whatever you're talking about, it doesn't match anything in the questionnaire you sent me. And I said,
because I went to other doctor and the doctor
Yeah.
told me, hey, that is for the implants, the breast implants. You have to change it. So I see that is happening. But you told me, hey, if you change that, you will see that you will find the real reason with that. So I say, okay, I'm gonna do this first,
Yeah.
and then if not, I go to the
And so
but
you
I
did not need to get the implants. You didn't have to take out. They're
no,
still there. And now you're feeling better. All these symptoms disappeared. So
yeah,
thank you for giving us the chance to help you. We're grateful with that. Okay.
thank you.
Thank you. And again, thank you for getting on the call, Ms. Castano. And we're ready to help you next. See you soon.
Thank you, Mr. Thank you.